Okay. So once again, good morning, students. So today we will be discussing on the topic of arteries and veins in the lower limb vessel. Means whatever like veins and arteries you all are having in the lower limb side in your leg portion, we will be discussing about that. We will be revising on that topic. Okay, but before starting, I would like to discuss about some few terms on this, that is dorsum and plantar. So dorsum, if I say dorsum or else dorsal, what does it mean? It means that dorsum is the upper side of the foot. Understand? Or else you can say the top of the foot, which is this. Okay? And the next one, that is plantar. Plantar means this. It is known as the sole of the foot, this one. Or else you can say at the back side of the foot. Is it clear? Dorsal means front, means top, and plantar means down portion, means back. Is it clear? Okay. Okay, now let us see about the lower limb vessel. So in the lower limb vessel or else the lower limb artery, what you will find? You will find the femoral artery. So this is a femoral artery, and the femoral artery, from where does it begin? The femoral artery, it begins in the middle point of the inguinal ligament. So this is the inguinal ligament. This green color, no? It's marked in green color. So this portion is known as the inguinal ligament. So the femoral artery, it usually begins from this inguinal ligament in the middle portion. Okay, which means what? Like here. Obviously, it will be from here. Here also same. So it will be from here. Okay, so this is the inguinal ligament, and it will start from here. That is in the middle point. Understand? And what happens here? Uh, it extends downward in the front of the thigh. So it means what? Like they will extend, like they will come down, and ultimately they will reach your thigh portion. That is at the front. This is your thigh, right? So it will be right at the front portion. Okay, and eventually it will pass around the medial aspect of the femur. Means it will come down and down, and ultimately it will reach the femur. Femur, you know, right? The longest bone in the human body. So it will reach, and femur, it's situated in your thigh portion. So it will like lie here in this portion. Okay, and it will enter in the popliteal space, from where the popliteal artery begins. So this is the popliteal space, and yeah, this is a popliteal space, or else you can say popliteal fossa. So from here the popliteal artery begins. Is it clear? Means it will be like behind, it will be at the back of your knee. So this is your knee, right? So it will be at the back here, and here you will be able to feel your pulse also. In the popliteal artery, you will be able to feel your pulse, and you will find that this popliteal artery, it is divided into two branches, which are the anterior tibial artery, this one. Anterior means front, and the next artery is the posterior tibial artery, which is this. Posterior means back, so it will be situated at the back. Okay, the popliteal artery again is divided into two, which are anterior, this is anterior front portion, and the posterior tibial artery, this one, back side. Is it clear till here?
Yes,
Okay. Okay, next is anterior tibial artery. Let us see in the anterior tibial artery what you will find. So the anterior tibial artery, it lies at the front, right? So the anterior tibial artery, it is in between the tibia and the fibula. So this is a bones. Don't get confused. This is the bones. I'm just showing it, you all for yeah, better understanding. So the anterior tibial artery, it is situated right in the middle. That is in the tibia and fibula. These are the bones which are situated. Anterior tibial artery is situated right in the middle of in between these two bones, tibia and fibula. Okay, and after that, what happens? This artery, it will go like downwards. Okay, that is in your ankle portion, this portion, and it will continue in the dorsum of the foot. Dorsum means this one front, right, top. So it will go on continuing. The anterior tibial artery, it will go on continuing, and it will reach here, this portion at the dorsum, means at the top portion of the feet, okay, which is known as dorsalis pedis artery. This one, dorsalis pedis artery. Dorsalis pedis artery is the continuation of anterior tibial artery. Is it clear about anterior tibial artery?
Yes.
Okay. Okay, and here in this dorsalis pedis artery, what you will find, it lies in the anterior. Obviously, it will lie in the anterior front portion, and in this anterior tibial artery or in this dorsalis pedis artery, sorry, in this dorsalis pedis artery, what you will feel, you will be able to feel the pulse also. Okay, and here arteries like arterial blood are being supplied in this area. It is the dorsalis pedis artery, and you will be able to feel your pulse. Is it clear?
Yes, ma'am.
Okay. Okay, now let's see about the posterior tibial artery. This one, which is situated right behind the knee. This is your knee, right at the back side. You will find the posterior tibial artery. It lies at the middle. It lies in the middle part of your leg at the back side. I hope it's clear. Okay, next is the plantar artery. So this is the plantar view. Okay, means you can say the place the in your toe, the place where you step the feet. That part or else that portion is known as plantar. Okay, I've already discussed also in the first in the beginning. Okay, so this is a plantar view of the foot. So in the plantar artery, so these are the plantar artery. This is the sole of the foot, and this artery, in the plantar artery, the plantar side, you will find the dorsalis pedis artery. This is the dorsalis pedis artery, and this dorsalis pedis artery, they will form the plantar arch. Okay, which is this? They will form the plantar arch. This one, lateral, or else it is known as lateral plantar artery. This one, and this lateral arch, or sorry, yeah, plantar arch, or else lateral plantar artery, they will form the digital arteries, and it will supply to the toes. So these are the digital arteries. Okay, means at the tip portion of your like fingers, you will find the digital arteries to supply blood to their toes, to all this portion. I hope it's clear.
Yes, sir.
Okay. Okay, we are done with artery. So now let us discuss about the lower limb. veins. So in the lower limb veins, you will find that two types of veins. Those are deep veins and superficial veins. And deep veins and superficial veins, we have already discussed about this. Deep veins, it lies deep, and superficial, like just beneath your skin. It is situated. Okay. So what happens here in the lower limb vessel? Your blood enters first in the superficial veins. Okay, this is the superficial veins. And passes the superficial veins, they passes to the deep veins. Okay, and with the help of what? With the help of some communicating veins. Communicating veins means they all are like how to say, intertwined together. They all are like together, so that's why it is known as communicating veins. Understand? They all are like, yeah, intertwined together. They all are like together, so that's why like they are known as communicating veins. I hope it's clear. Okay, so let us discuss about the deep veins. So the deep veins, they accompany the arteries and their branches. Means what? The deep veins, like they work together. Okay, they work together with the arteries and their branches. So from the picture itself, you can see like they all are like intertwined together. They all are like together. It's not it. So it's like that. Means they help together each other. Okay, next is femoral veins. So same thing, femoral veins also. It was from the inguinal ligaments, which is this. It will start. I mean, they will come down. So same thing, middle portion, it will come down, and to your thigh portion, it will go. Okay, this is the femoral vein. So this is the inguinal ligament, and it will come down and down, and ultimately it will come in your thigh portion, just this. I hope it's clear. Okay, next is superficial veins. Okay, so superficial veins, what you will find here in the superficial veins, the superficial veins, they drain blood from the lower limb vessel. Okay, from the lower limb vessel, which are the small and the great saphenous vein. Understand? Like from the femoral vein, it will come, and you will find the small and the great saphenous vein. So the great saphenous vein, like they lie here, okay, means at the back, and the small is at the front, anterior, and this is the posterior side. Okay, it's clear. Yes or no? Is it clear?
Yes, sir.
Okay, so now let us see about the small saphenous vein, which lies at the anterior side. So the small saphenous vein, they lies behind the ankle. Okay, so they are like this is the ankle, and they lies at the back of the ankle joint, which brings the dorsum of the foot, and they join together. So this is the small saphenous vein, and they lie at the back side of the leg in the popliteal space. So they usually Okay, so they usually lie at the backside of the leg, okay, in the popliteal space. So this is the popliteal space. Means what? Like they will start from here, they will begin from here, and they will go up and up like this. Okay, and finally they will join in the popliteal space. So this is the popliteal space, and finally they will join in the popliteal vein, which is the deep vein. Understand? Yes. Like they will go like up and up and up and up like this in this manner. Understand? They will go up and finally they will meet in the popliteal space, this one, and finally they will meet here. It is in the popliteal vein, which is also known as deep vein. Is it clear? Is it clear?
Yes, ma'am.
Okay. Next is the great saphenous vein, which is this. So the great saphenous vein, you will find that they are the longest vein in the body. And the great saphenous vein, from where do they begin? They will. So the great saphenous vein, you will find that they are the longest vein in the body, and it usually begins where? It usually begins in the medial half of the dorsum of the foot. So here, dorsum means upside, right? So from the middle portion of the foot, like it will go upwards like this. Understand? It will go upwards, and they will cross the medial aspect of the tibia. Means in the middle portion, there is tibia and fibula, right? In the previous slide, I have showed you. So they will lie in the, they will run in the middle of this tibia, and ultimately, like it will reach the thigh portion. Okay, it will reach the thigh portion, and finally the femoral vein, which is in the just below the inguinal ligament. So this is the inguinal ligament. So they will like stop here. Okay, where you will find the femoral vein. Okay, I hope it's clear about the great saphenous vein.
Yes, ma'am.
Okay, so all the veins from the like this one itself, you can just know now that they all run upwards because they need to go and reach the heart. That is the deoxygenated blood. I hope you all remember that is the inferior what in the heart. What do we get? Superior vena cava and what? Inferior what?
Pinnacle.
Hmm. Inferior vena cava. So they will go. They all will go in the inferior vena cava to go and supply the deoxygenated blood. Understand? So that's why like they all are going in the upward direction. Are you clear?
Yes, ma'am.
Okay. So that was about the veins and arteries in the like lower limb vessel. I hope everyone is clear.
Yes, ma'am.
Okay, if it is clear, then uh, Surajit Kalita, am I audible to you? Surajit, clear. Okay, can you please tell me the femoral artery? It begins in which ligament? I have said na some ligament. So what is the name of that? You can write in the chat box also, no problem. So what is the name of the ligament? I have mentioned. You please write in the chat box. Type inguinal. Okay, good. So yes, it's correct. So this is the inguinal ligament. Okay, like it begins from here. It starts from here. The femoral artery. Okay, and next question. Uh, okay, the next question is the popliteal artery, right? So the popliteal artery, again, it is divided into two arteries. What are those? What is the name of those two arteries? Srijana, can you tell me?
Anterior and posterior tibial arteries.
Okay, very good for this. Okay, so and this is the anterior. It lies in the front, and posterior means back. So it lies in the back. Okay, good. Okay, in which like in this portion, right? In this portion here, this green color. I hope everyone can see. So in this green color portion, what pulse can be felt? What is the name of that pulse, Sheetal? Am I audible, Sheetal? I have mentioned one pulse. So what is the name of that pulse? Senkamchi? Senkamchi or Marak? Can you hear me? Okay, Samuel, can you tell me? Samuel, what happened? Salam Girija Devi. Salam Girija Devi.
Yes,
Okay, can you please tell me? I have mentioned one pulse, right? That it can be felt in this area, in this. So what is the name of the pulse?
ma'am.
Huh?
Popliteal artery.
Yes, the answer is already there even. You just need to be okay. Okay, good. So in this area, you will be able to feel your pulse. So this is the popliteal artery. Okay. Okay, the dog. The dog. Can you hear me? The dog.
Yes, ma'am.
Okay, the dog. Can you tell me the difference between plantar and dorsal or else dorsum?
Pardon, ma'am.
Can you tell me the difference between dorsum or else dorsal and plantar? Do you know?
Uh, I don't know, ma'am.
Can you see this?
Yes, ma'am.
So this portion is what? Can you see I'm
The-
moving the
Yes, ma'am.
what?
I can see, ma'am.
So can you see I'm moving the arrow?
Yes,
Yeah. So this is what?
a dorsal.
Or else you can say dorsum. So what comes to your mind if you like the difference between dorsum and plantar? If what comes to your mind? By
Mm.
seeing the picture itself, it's like common sense, right? So just by seeing the picture itself, dorsum plantar, what comes to your mind? Dorsal or else dorsum, what can it be? Or else what will it be?
Uh,
From the picture itself, you say dorsal is situated where? Up, down, side.
it's situated upside,
Hmm. And plantar?
downside.
Hmm. Or else back. Okay. It means that. So this is the difference between dorsum, or else, and plantar. Is it clear now?
Yes, ma'am.
Okay, I don't want to hear that I don't know from your mouth because
Okay,
I've already explained to you.
okay,
Okay.
ma'am.
Okay, next question goes to Rashmi.
Yes, ma'am.
Okay, Rashmi, can you tell me the anterior tibial artery, no? Sorry, not anterior tibial artery. In the dorsalis pedis artery,
Yes, ma'am.
okay, what I'm saying. Okay, can you say this?
Yes, ma'am.
Okay. So the dorsalis pedis artery, it is the continuation of which artery?
Ma'am, tibia and fibula.
Tibia and fibula. No, no, no. It's not tibia and fibula. Means, of course, the anterior tibial artery. Of course, the anterior tibial artery, like they passes in between the tibia and fibula. Okay, this is tibia, this is fibula. So the anterior tibial artery, it will be situated in the middle. यहाँ पे middle पे मतलब ये जो anterior tibial artery है ना यहाँ पे आ जाएगा. उसके बाद धीरे धीरे it will go down, down and down. Then it will reach the dorsalis pedis artery. So ultimately, it is the continuation of anterior tibial artery. Okay, not fibula. Of course, it's like it's in the middle, like they passes in the middle, but it is the anterior tibial artery. Okay, Rashmi, don't get confused.
Yes, ma'am.
This is the dorsalis pedis artery. Okay, and you will be able to feel your pulse also right here in the dorsalis pedis artery. Okay. Okay, now let us see about the veins. Okay, Nisha.
Yes, ma'am.
Okay, Nisha. Can you tell me the great saphenous vein from where does it begin?
It begins at the middle half of the dorsum of the foot.
Middle half of the dorsum of the foot. Okay, and ultimately it will go and where it will go and like join where they will like yeah where they will go.
Crossing the medial aspect of the tibia and up the inner side of the thigh.
Okay, just down the femoral right inguinal ligament. That's not it.
Yes,
Okay,
ma'am.
and it is the what longest smallest.
It is the longest vein in the body.
Okay, okay, very good. Okay, I hope everyone is clear of this class. Any more doubts? Any more clarification is required? Yes? I
No,
hope,
ma'am.
okay, I hope it's done then. Okay, then we'll end, we'll stop here.